Where was Dr. Matacola when I needed him? I had 7 concussions. So if I forget anybody's name, I have a good excuse. So from compounded injuries in jockeys to compounded medications in horses. We've got 3 panelists to speak on this subject. Dr. Dionne Benson, Executive Director and Chief Operating Officer of the Racing Medication Testing Consortium. Dr. Lynn Hovda, Chief Veterinarian, Minnesota Racing Commission. And Dr. Scott Stanley, Professor of Equine Analytical Chemistry, University of California, Davis. If you all could please come up and please welcome them.
Clickers on the.
So we're going to talk a little bit this afternoon about compounded substances. And I just joked with Dionne and Scott earlier yesterday that perhaps we should have called this the good, the bad, the ugly, and the really ugly. We're all scientists, so I think a good start to this is a definition of what compounding is, because even the veterinarians that I work with on the backside forget that compounding is really combining, mixing, or in some way altering the ingredients of an FDA-approved drug. And that needs to be done by a licensed veterinarian or a licensed pharmacist. And it needs to be done to meet the specific needs of a specific animal patient. So we're not going to go through all this. Really, the slide is here so you can have some idea that compounded substances have been regulated really for well over 100 years. Currently, the FDA, the College of Veterinary Medicine, regulates pharmaceuticals, including compounded medications used by veterinarians in their practice. So the question is really, why regulate them? Well, the answers are many, but compounded substances are really not FDA-approved medications. They may not work effectively in the horse. Sometimes we take human medications and try and make them work in the horse, and they don't. They may be more or less potent. They may be misbranded, which basically means that what is found on the label is not necessarily what you're getting. They may be contaminated. They may contain other things than you think that is present there, or they may be adulterated. And adulterated medications are really those that are probably less potent. And the compounded substances of current regulations, again, are for a specific animal patient. They need to be appropriately labeled. They need to be made from FDA-approved medications. They cannot be made from bulk substances. And bulk substances are really the raw ingredients that are used to make FDA products. And they cannot be made in large amounts and sold or carried by veterinarians for resale. And the FDA currently does not acknowledge the need for large amounts they do acknowledge the need for large amounts under limited circumstances. And I'm going to turn this over to Dr. Benson.
So the available pharmaceuticals, you look at the FDA-approved drugs. They're also known as pioneer or legend drugs. Again, ideally you look for one that's approved for use in the horse. Then you look to other animals, human beings. The next stage is a generic drug. Generic drugs are not compounded drugs. These are still subject to the same requirements of FDA purity, efficacy, et cetera. They are just representative of drugs that are already off patent, the pioneer drugs that are off patent and can be used or made a little bit more cheaply usually. And then you have compounded drugs. So the FDA approval process, all of these things need to be proven during the FDA approval process. They need to provide a dosage or dose range. They need to prove efficacy, safety. For food animals, they have to provide withdrawal times until they are safe for use in animals that that either have products that are consumed by humans or that by themselves are consumed by humans. There are very strict manufacturing requirements. They also have to be stable. They have to have appropriate labeling, packaging, advertising. For example, they have to have specific names. Certain names are not allowed. They can't be names that point to efficacy or effectiveness or things like that. And you have to have a reporting requirement for adverse events. So if you look and compare FDA-approved medications to compounded substances, these are some of the concerns that can be present. And we're not here to say that no medication can be compounded. All medications that are compounded are inappropriate. But these are some of the increased risks that you have with compounded substances because they are not required to have research. They are not required by law to show safety, efficacy, or stability. Now, there are some compounding pharmacies that go through these steps, but they are not required to. There's no guarantee of consistent medication concentrations. There's no purity requirements, and they are not, again, not the same as generic medications. Things that are important for the veterinarian to realize that they assume all liability for damages due to the use of compounded medications. Their insurance policy does not cover any adverse event. In the event that a horse dies, their liability insurance will not cover that any claim against them. Most states do not allow veterinarians to profit from the use of compounded medication. They are allowed to mark up legend drugs. They can charge a prescribing fee, but they cannot actually mark up the drug itself. Compounded medications include mixtures of FDA-approved medications and flavorings.
Okay, so continuing on, so some of the other things that we want to embark on you is that there's a legality component to this, and one of the things we always try and explain to veterinarians is that they assume the liability for those efficacy failures. But one of the key things that people don't understand about compounding is it's intended to be from an original FDA-approved product. So it's illegal to compound from bulk or from another form. So you're supposed to use the original FDA product, alter it in a form to dose either another species, a smaller animal, a larger animal, formulate it so that it's available for flavor or taste, but it's not intended to be from bulk forms of these products. So in order to follow that, you must use an FDA-approved product in order to make the new product. If not, then it's considered a new drug form. So starting on some of the compounding issues that we have, some material, we're going to divide these up into between the three of us to talk about the different examples that we have. Starting off first, I think...
This one is mine, Scott. We had an issue about 2 or 3 years ago where we had a number of triamcinolone positives, and our investigators went out and asked the practicing veterinarians what they were using, and it was at a time when Vetilog was on back order. So they brought in some compounded medications for us, and we sent them to the testing laboratory. And one of them contained considerably less than 2 milligrams per mil. In fact, it contained almost sterile water. And the other one contained almost twice the amount of triamcinolone that was on the label. So we had a pretty good discussion with our practicing veterinarians, and I believe they all switched to Kenlog, and I think they all continue to use Kenlog to this day, even though Vetilog is back on the market. This one's yours.
So we run into a lot of odd things as well, and as Dr. Hovda just said, one of the things that we constantly are asked are withdrawal times for medications. So if a practitioner doesn't know what medication or what dosing they're giving, it's very, very difficult for them to comply. In this circumstance, this is a product that was being distributed at the racetrack called Sangre Caliente, and you can see circled at the top, this was the clear strength, not the red strength. So it's easy to determine the potency just by determining whether it's clear or red. If you read through the label, it also never ever says what the actual component is. This product was loaded with clenbuterol. It actually has 4 times the FDA-approved potency of the vetapulmin syrup that's used. You can see on their label, it says it's very, very potent. It says how much to give depending on the age, the size, and the weight of the horse.
Hey, Scott, I heard they had blue ones now.
Well, we can find clenbuterol in pretty much any different potency, variety, and color you can imagine. This is actually an example here where acepromazine was put into a Vetapulmin syrup bottle at a different potency and with a trace of another drug, acepromazine.
Oh, and this one is mine. Our investigators get busy sometimes on the backside, and so they brought in a plain brown bottle that just had clear liquid in it. And on the top it said 3X, or maybe it was a 2X. We weren't really very sure what it was, and weren't very sure what the medication was, but the trainer was using it. How, we're not particularly sure, but the trainer was using it. And we sent it off to the testing laboratory, and it wasn't a 3X and it wasn't a 2X, but it was a 1.5X. This one is yours too.
So actually, this is just another example of clenbuterol that's available. This is a 2X concentration. And the biggest issue that we have with this is there's no way to look at this material and determine how much drug is present. So clenbuterol used by either thoroughbred or quarter horse trainers in a potency different than the Vetapulmin makes it impossible for them to meet withdrawal guidelines. It's also impossible for them to know the consistency batch to batch. One of the issues that we've always discovered is whether we get a lot from a compounding pharmacy or from one of these other sources like this, the lot-to-lot variability is much more substantial than it is for an FDA-approved product. And again, an example here of 3 different concentrations from 3 different bottles. So it just highlights that problem of batch-to-batch variability between these different products that are provided at the racetrack.
Hey, Scott, can you explain lot-to-lot?
Oh, yeah. Lot-to-lot is basically a batch material is developed, would be considered a lot. So if they make 100 bottles at a time, that would be one lot and assigned a lot number. Generally, with compounding, it's much smaller lots. And in pharmaceutical development, it would be potentially thousands. So it might be 5, 10 bottles that are made, and then the next week they make another 5, 10 bottles, and those are different potency.
So this is one that I was actually, after the notice of the Welfare Safety Summit came out, I actually got an email from several jurisdictions, and one of them, in fact, came to me in the form of this. This was a substance that was marketed as Bacox as a treatment for EPM. It was sold to a trainer, actually several trainers. The track had 4 positives for levamisole, all traced back to the same veterinarian. He happened to have 1 vial of this left, and when they tested it, it tested positive for levamisole. So a completely different drug than what they had on the label. And then the other one, Dr. Hovda received.
I sent a very similar substance to the testing laboratory, again labeled toltrazurol and pyrimethamine, and it came back omeprazole. So that particular trainer had paid quite a bit of money for 5 tubes and got omeprazole.
So the FDA actually considers those products misbranded if in fact it doesn't contain what the label says it contains, and that's a violation.
I think this is you, Scott.
Okay, so there's a little difference between what we're trying to represent here is what's legal and what's illegal. So just to highlight that, not spend a lot of time on it, the FDA says that anything that's compounded from bulk, anything that's not used from an FDA-approved product, something that's not a pharmaceutical source, is actually illegal. So bulk manufacturing for veterinary healthcare is actually illegal. FDA actually doesn't have an authorization for compounding. They use what's called their enforcement discretion not to pursue these compounded products because they know veterinarians need them for some day-to-day treatment. The problems become is when they go beyond what's an approved or an acceptable process. It's also not appropriate to provide mislabeling of information, as we showed before with mislabeling and misbranded. And it is required, probably one of the most important things that's overlooked, the compounding pharmacies can't dispense directly to the client. They must go through a veterinarian, and that veterinarian has to establish a veterinary client-patient relationship through appropriate diagnosis. And part of that veterinary client-patient relationship means they have to be able to follow up with that animal and investigate further. So in some cases, we know that these prescriptions are provided through just a phone call made by the veterinarian, and that's not an acceptable patient-client relationship.
I think one of the problems we run into with bulk manufacturing too is the quality of the medications or the quality of the bulk substances, many which are purchased from Southeast Asia or other countries?
We've actually done some investigation. We actually found one of the Omeprazole products was provided through 3 different shipping routes from a source in India. They were buying the product enough at 6 cents per dose and then marketing it up at $18 per dose syringe. So a big profit margin in that. But one of the concerns that we have is that that's not pharmaceutical grade chemical. That's bulk grade chemical that's coming over from another country that has not been evaluated for appropriate use. We don't know the potency, sterility. We don't know the basis of whether that product could be used or should be used as a pharmaceutical.
Is it possible that those bulk compounded or those bulk substances are contaminated as well with heavy metals or other substances?
We have great concerns about the contamination of those, not only with the heavy metals, but also other sources, because they don't go through the strict control of sterile production that would happen in an FDA-approved pharmaceutical product.
I guess this one is for me. So there is legal compounding, and we're not here, as I said before, there is some good. Legal compounding is mixing of 2 injectable drugs for a specific horse, and that might be mixing a corticosteroid such as triamcinolone with hyaluronic acid for intra-articular or IM use. It might be mixing butorphanol and ditomidine for sedation, or we might be mixing acepromazine and butorphanol or acepromazine and xylazine for sedation. It also includes crushing tablets to create an oral supplement or an oral suspension or an oral paste. Sometimes we crush tablets and make a paste for foals that are hard to treat. Sometimes there are horses that are really pretty bad about their mouth, and we crush up some methylcarbamol tablets and mix them with Caro syrup or some form of a diluent and administer it that way. It also is adding flavoring to a commercially available medication. Apple flavoring is often added to phenylbutazone, can be added to other things. And often it's just mixing several ointments together so you have a single application of a compounded ointment rather than 4 separate ointments.
So I think we've just tried to provide some examples and pictures of each of those scenarios. These are the mixing of the sedative and pain relief, crushing up methylcarbamol tablets, apple flavored, and Dr. Stanley, if you want to talk about this one.
Yeah, this is the one that we discussed. It was one of the individuals that provided this. This was a product that the animal would not eat as a normal flavor, so they took the FDA-approved pergolide pills, ground it up, and added it with an apple flavor component into a mixture so that the animal would eat that product. I think it was a 40-year-old horse that they were trying to treat. So there are some circumstances where that's an appropriate use, but again, in this case, they started with an FDA-approved product.
I can probably talk about the next 2. These could be actually legal compounded medications. As you see, there are a number of things that were put in them. The only label, however, was the one on the front that said Scratches Meds. There were no other labels on the container. But you can mix, or veterinarians can mix all of these things together and make one product. And it's the same thing with this one. It's a product that a trainer was using actually for a throat flush, and it had been mixed by a veterinarian, furosin, DMSO, and dexamethasone. The ingredients were not listed on the label. The instructions were poor, and the trainer actually ended up with a dexamethasone positive. And when he brought in everything from his tack room to see where it came from, we found this.
And that becomes a big problem for a lot of the products that are dispensed. If they don't have appropriate labels in some jurisdiction, that alone can be a violation because we don't know what horse it is. But also veterinary and pharmaceutical requirements say that the label has to have what the active ingredient is.
I think it makes it hard for the trainers and actually the veterinarians to stay within the recommended guidelines as well if they don't know what's in the product.
So this is an example of a FDA product that's been discontinued. This is stanozolol. It used to be distributed as Winstrol V. It hasn't been available for over 20 years, although it has not formally been removed from the market. However, this is a DEA-controlled substance with very strict guidelines now in racing for the use of stanozolol, and some of these products are then still made by compounding manufacturers and dispensed. In some cases, we've had those DEA-controlled substances dispensed directly to a trainer, which is a violation of DEA regulation.
So this is wading a little bit more into the gray area. For example, right now, ketoprofen is off market. There's an FDA-approved product that is presently not available to veterinarians. This picture was actually taken when it was available to veterinarians, so that's obviously not appropriate. But even looking at the strict interpretation of the FDA's rules would require you as a veterinarian to use Banamine or phenylbutazone, another non-steroidal anti-inflammatory, instead of using a compounded version of ketoprofen. Now, different jurisdictions are going to have more or less leniency on this, on the use of a product like this when it's off the market, but certainly if the FDA chose to, they could enforce this as being a violation of compounding rules.
But the FDA for most of these products will defer to the State Board of Pharmacy, and it may vary from state to state if you're able to use these illegally or not.
So here's just a list of illegal compounding that we've seen. So where bulk drugs are used, we've mentioned that several times. Bulk manufacturing, I can tell you there have been times when I've gone into a barn and found 150 tubes of omeprazole paste mixed with ranitidine, all for the same horse, and I'm pretty sure that horse didn't need 150 tubes at once.
Or worse yet, for the trainer's dog.
Yes. Inappropriate labeling, we see a lot of that, as you saw in the pictures above.
The other thing about omeprazole, it's a particular drug that's unstable to begin with. We've done studies showing its stability of omeprazole in paste form and in solutions where it doesn't have much of a shelf life at all. It needs to be used fairly recently after it's prepared, otherwise you get rapid degradation of that product. So having 150 tubes of this material, by the time you're using the last tubes, it probably has zero potency.
Not only that, but I was just at the American College of Veterinary Internal Medicine annual meeting and sat in on actually a very good small animal discussion, but I think it crosses over to different species on the use or misuse of these medications in human beings. And I was reminded that ranitidine works at the level of the parietal cell and decreases the amount of hydrogen and therefore the acidity in the stomach, and that omeprazole needs to have acid to work. So the suggestion was made that perhaps instead of using these together, it would be much better to separate them by an 8 to 12-hour period.
And then you've got where there isn't a valid client-patient relationship and things are ordered via the internet. We actually have had trainers order things for us to test, and they've gotten things that on their website or on their advertising say it has to be ordered by a veterinarian. This is an example of something that is a compounded product being made in lieu of using the label product. It's straight illegal compounding in my mind. Again, same thing with betamethasone. These are all things that have been found in different jurisdictions, in different veterinarian trucks, as well as in some cases in tack rooms or in trainers' possession. So the next topic that we have is it compounding or is it a new illegal medication? And this is, you can argue that many of these are both. This is one that is particularly concerning to me. This is a mixture, it's Gastrotech, it's supposed to provide omeprazole for the proton pump inhibitor in the stomach for stomach ulcers, and then misoprostol is supposed to be a right dorsal colon ulcer treatment. This product had an FDA cease and desist issued earlier this year. It was being sold directly over the counter to trainers. Veterinarians were not always involved. It was being sold on the backside of racetracks. People were in training centers, people were peddling it. Even after the FDA cease and desist was issued, this was still being sold to farms, to trainers, on training centers, everywhere. And well, people might think, well, it's just a couple of anti-ulcer type medications, what do we care? Well, again, omeprazole is not very stable, needs to be made specially for the horse, and there is an FDA-approved product. And misoprostol is what's called a human black box drug. It has significant warning on the label tied to human use and human safety. It is a portion of the abortion cocktail for humans. There are no warnings on this box for it not to be handled by women, pregnant women. It says don't give to pregnant horses, but it doesn't say why.
So the FDA actually issued to 5 different compounding pharmacies notifications on omeprazole because they were making claims about healing ulcers, and they can't make those claims with a compounded product. In addition to that, what they also did is they tested these products for potency, and the omeprazole concentration in some of them were as low as 27% of a label claim. So they listed them as adulterated as well as misbranded when they distributed that information and sent out the 5 cease and desist notifications. In some cases, or at least 2 of those, the companies continued to make it but just provided it under another name and distributed it out readily again.
Dionne, I think this is the one, too, that in addition to just being sold directly to trainers, you could buy it online at some fairly reputable places.
Yes, and I think a lot of places carried it prior to the cease and desist issue or letter being issued.
So this is some material that we got to do some investigations in California after a positive. These were actually medications that are used as a pre-race bleeder medication in some locations, and we investigated the use of these particular products by doing some drug administration trials. But these are compounds. Carbazochrome is more commonly known as Kentucky Red, and used and permitted for use in some jurisdictions. But these are not FDA-approved products in any form. So the carbazochrome and the aminocaproic acid don't have an initial product that are out there for use in veterinary medicine. So these would actually be considered new drugs and a violation of FDA formulation because there is no scientific data of efficacy, potency, or safety for these products.
So this is one of the products that I see often, omeprazole mixed with ranitidine. As Dr. Hovda mentioned, the ranitidine likely makes the omeprazole, even if it were the FDA-approved version for horses, ineffective. So mixing these together creates a new medication and is probably would be considered illegal by the FDA.
This is a drug that was confiscated in the Southwest, and this was a product that actually the pharmacy thought that they were working, or claimed that they were working with the FDA as a new drug that they were developing and doing their own individual research. If you don't have a new drug animal application in place with the FDA, and you certainly don't test this in an environment where you're doing client horses, this is not a new drug animal investigation. This is just compounding gone awry with an injectable form of clenbuterol, which is far more potent than the syrup formulation because it's so quickly absorbed.
So again, additional things that we see mixtures of, and each of these individually may be fine, but when you mix them together, we're not exactly sure what they become. Do they become less potent, more potent? Do they become battery acid, as Dr. Hovda likes to say? And the issue is, when you're doing this in bulk, you're not doing it based on a specific diagnosis. Additional thing, this basically the idea is to save the veterinarian a step of mixing triamcinolone and amikacin, both of which are readily available at this point.
This is one, I believe, Jamie, is Jamie available? This is one of his favorite. This is Purple Pain. It was distributed from a company called horseprerace.com. The first thing, and the reason I wanted Jamie involved is because he noticed right away, what's wrong with this picture? It's green. Purple Pain's not green. It actually came purple and turned green over time. So this is a concerning situation where you've got a potential pharmaceutical then that changes color. This is when you throw stuff out. quickly you get away from this. But this was a product that was actually labeled only for research use, listed as potentially a product that could not be used in humans at all. But it was sold and distributed as a product that has the same 8 amino acids as dermorphin. Some of you might remember dermorphin being this synthetic or naturally produced opiate mu receptor binder that was used in quarter horse racing and results in a potent stimulation and potentially analgesic effect. This has the same 8 amino acids, but they weren't connected, so this wouldn't test. Well, if you put 8 amino acids that aren't connected together in a bottle, you get 8 amino acids that aren't connected and don't do anything that cost you $25 and you get nothing.
And you're lucky it didn't form a big precipitate.
I think these are just additional substances that we found. Oxy E500, it's likely, if it's similar to the other Oxy products, bleach that people inject into veins. Same formulation.
And we have some of the products also that provide the withdrawal time or the time of dosing prior to the competition. So you're supposed to give it 4 hours, as I believe the one on the right says, before the competition. Sorry, 30 hours
30
out
hours
from competition. And we have the more famous stuff from Weatherford Pharmacy in Texas, which is no longer in business, but still does some work under the pharmacist. This product was Exacta, sold a very good name, but didn't provide a lot of anything other than amino acids and some vitamins. This is an infringement on a company's logo for the Monster Energy product that they provide. So there's a plethora of different things that you can buy and distribute to the client that has virtually no pharmaceutical efficacy or value whatsoever. And remember, the veterinarian absorbs all the legal implications from any efficacy failure or any adverse effect from use of these products.
Is this one mine?
Yes.
This isn't an injectable product, and if you read, I was asking Scott about this last night, because it says trichlor-1-thiazide plus dexamethasone, which actually is the old Noquisone, and we used it in cattle Noquisone boluses, only this is now an injectable product. Who knows how it works? Who knows how long the withdrawal time is on this particular one?
This is TB500, or better known as Thymosin Beta. It was a big thing about 3 years ago. This particular bottle we purchased, actually we had somebody purchase this off the internet. It was $129 per bottle. We tested it many times. It does not contain any Thymosin Beta 4 at all. We did find some other TB500 products that did contain Thymosin Beta, but in this case, in many cases, we receive products either through an investigation or from a concerned veterinarian that don't contain the material that they're claimed to maintain on this. So this would be a misbranded and adulterated product if it was even an appropriate product to begin with. The possession of this at a veterinarian would immediately be considered a prohibited substance. You can see it comes in a freeze-dried formulation, so it looks very, very legitimate. It just contains no active pharmaceutical ingredient whatsoever. We have had other clients spend as much as $2,000 to get injectable products. This was FGF 1000. Was supposed to be a super growth factor component. That's not this product here. The game changer, $2,000 for a box of 6 vials that contain no active pharmaceutical.
It did contain sheep collagen, though,
Yes,
so you could put it on your face.
That's correct.
Wrinkles.
It contains sheep collagen, so if your horse had wrinkles and injected it, you'd be good.
Yeah. Yeah, this is just some more things that we found in inspections in different places. Game changer. There are hundreds and hundreds of these in bottles that we found.
This was a more interesting one. It was sent to us during an investigation of a positive. It's called Tourniquet. It's listed with amino acid and vitamin products in there. But the trainer came forward when he had 4 positives for sildenafil. He had 4 positives, 2 horses each day, 2 days in a row. And he brought the product forward, and he said he thought this might be related to the finding of the sildenafil. Well, we were a little skeptical, but we did test the material. We found that it does contain sildenafil. It was claimed by the pharmacy as well as the trainer that it was contaminant of a Chinese herbal medication that they bought through a distributor in Canada. They then started, the trainer eventually was given I believe it was a 10-year suspension, a $60,000 fine. He sued the distributor out of Canada for $6 million for this particular product. Later, it was found in the compounding pharmacy during an inspection. So there was little concern that this was a contaminant. It was an intentional treatment because the sildenafil is actually a 5-phosphodiesterase inhibitor, which could, in fact, affect or abate a horse from bleeding, thus the name tourniquet.
Carolina Gold, we see a lot of this in different veterinarians' trucks. It's used as a calmer. It's part of a naturally part of the horse, but obviously it's been given both in horse racing and in other competition to calm a horse prior to a race. Compounded product. It's gamma aminobutyric acid.
These were a big product concern for the U.S. Equestrian. They came out a few years ago and made them illegal regulated medication. The Carolina Gold was GABA. Since then, the RMTC and most racing jurisdictions have also restricted the use of these particular products because of the demonstrated effect that can be used at high doses.
And what's interesting about this photo is the prescriber, Dr. William Izimoto. He was not the vet that we pulled this from. So obviously they're not even changing the label or the vet name before they send these out.
One of the things that we definitely see is a repetitive problem with certain compounding pharmacies where their name comes up over and over and over again related to products that are problematic or inappropriate and in many cases illegal.
Here's just another version. It's sold to veterinarians only. It doesn't even have any ingredients on this label. So.
Going back to the original, or going back to your comment about veterinarians and not changing the veterinarian's name, remember back when we had the veterinarian from one state who ordered a product from Ohio and it turned up in a truck with his name on it in New Mexico?
Yes, and never practiced in New Mexico. This is a product, Windy Cough Syrup. It just says it contains prohibited substances, doesn't say what it contains. It's in an old alcohol bottle. I'm not sure that's the best idea. It doesn't quite meet the minimum standards for labeling. And it may be fine if it had the minimum standards, but because it was made by a veterinarian. Again, here's a product. We have no idea exactly what's in it. Most of these things we sent to be tested, and they contain amino acids and sugars and vitamins and maybe a stabilizer. But other than that, you're paying a lot of money for vitamins in this case, and it's not really going to do anything.
So again, a lot of times what the compounding pharmacies will do, they'll combine a product with another product in order to say it's different than the FDA-approved product. Thus, they can compound it for the veterinarian. So L-arginine is a product that they added here to ketoprofen to say, well, you can't get the product in this combination. That became a fatal circumstance in a case last year where they combined two products, totazerol and pyrimethamine. They unfortunately switched the potency of the two products, or best it can be determined, they switched the concentration that was added. So they made a lethal dose of pyrimethamine, killing several horses because they misformulated the two products in one syringe in a one solution. So that's one of the reasons the FDA takes a very close look at using mixtures of concentrations of drugs that have that kind of potency, because a mistake like that in that case became fatal.
Again, here's another one that was found in a veterinarian's truck, compound 150 for veterinary use only. This is the only thing on the label. Equine growth hormone.
So a lot of these products that are confiscated or tested, and I think we've already said, most of them end up not being the product that's on the label at all. A lot of times we'll find, that there's actually no protein or peptide present in a vial like this at all. It's just a vial. In some cases, they substitute other drugs. We've had clenbuterol vials that contained albuterol, and as we already showed, we've had omeprazole that contain no omeprazole at all. So there's a lot of times, I think, where they run out of a product at the compounding pharmacy, so they substitute something else that's as close as they can come up with. Or in some cases, if they're looking for a stimulant, they'll just add a lot of caffeine.
Here's one similar to the one we looked at before. This is intravenous bleach. Mixture of 3 drugs, again, in order to avoid paying the full price for ketoprofen and pentosan and glucosamine. This one contains strychnine. This was an interesting one. At the point that we found this, you couldn't really read the label. It was expired by, I think, about 2 years. At the point we found it, it doesn't really say what's in it, what it's for.
And one of the other concerns that we have is that there's more and more, as these compounding pharmacies grow, they're more and more acting like a drug distributor or like a pharmaceutical company, where they're actually go market this directly at the racetrack. Mm-hmm. So in some cases, they have direct contact, they provide a list, and they provide, even sales of their product.
Yeah, they'll often talk their way back on the backside of a racetrack and be going from trainer to try and sell things directly to the trainers.
Or they'll use their website and just hand out a card to say you can find it on our website.
And it's very concerning that we talked about the client-patient relationship earlier. If you take the veterinarian out of the mix in these determinations, then they start using their own treatments. If something doesn't work well, they're unlikely to tell the veterinarian, well, I was treating him with this product that I got directly from the compounding pharmacy. So the veterinarian comes in unbeknownst that they've had a problem to begin with. So a lot of these become a compounded problem because that information is delayed in communication. So any of these formulations that actually have a pharmaceutical really have to go through the veterinarian to get the best care for the horse.
Mm-hmm. And this is an example of a medication that now Tildren is now FDA approved for use in the U.S., but at the time that this was found, it was not. So it was something that wasn't even approved by the FDA for use in any species.
And the FDA has a strict label limitation for horses that are 4-year-olds and up for the products Tildren and Osphos. So these bisphosphonate compounds are not supposed to be used in young horses, but yet we find them on the racetrack regularly.
It's my understanding that the makers of Osphos have taken some of these compounding pharmacies to the wall.
Mm-hmm. Yeah, I think it's difficult for each of them. I mean, you look at the makers of Gastrogard, they've done the same thing. And I think for them it's a constant fight and constantly trying to get their patent enforced. And, everyone says, well, we want cheaper drugs, but if you want new drugs, you, for a while, at least have to pay the price for the more expensive drugs because of all the research and development that goes into developing the drugs.
Yeah, one of the things we didn't talk about, and we should have mentioned earlier, it costs about $30 million to get a veterinary medical drug through the FDA approval process. That's an expensive investment. More and more of this compounding has resulted in some of these some of the pharmaceutical companies second-guessing whether they want to take a new product through for approval, because if it can be easily compounded, their market goes away immediately and their initial investment is gone. Most of the products that have 2 and 3 drugs in them could never make it through the FDA approval process. So a lot of those, we don't know what their stability, the potency, the efficacy of those products are. It's a bit of a guessing game for the practitioner.
In fact, from a purely pharmaceutical standpoint, the FDA is rapidly removing even human drugs that contain more than one substance for the same reasons.
So this is one that we found actually on a person going into the racetrack in New Mexico. They had a combination of Race Ready and Purple Pain in a different vial. Maybe the light protectant causes it to stay purple. But obviously they were intending to use it on that day, and it was a significant race day in New Mexico.
I guess Carolina Gold wasn't good enough. Nebraska needed their own, huh?
There were actually some jurisdictions that restricted the Carolina Gold particular product. So this is a case where a Nebraska compounding pharmacy just gave it another name and sent it back out.
Shark, this is one of my favorites. It's cartilage or glucosamine. I think they pulled 15 bottles from the veterinarian's truck. So obviously buying in bulk is an issue, as well as FDA approval generally.
The other thing that you'll look at these labels a lot, and they will have information about expiration dates. they don't actually ever test the expiration dates. We've done a lot of potency testing on these products over time. Rarely do they stay potent through the entire time. The reason that they have an expiration date or a use-by date is because by state pharmacy law, they're only allowed to give it 6 months. So most of them will have a 6-month or 180-day use-by date because that's what they're allowed to without testing it. So those products have really never ever been tested to find out if they're potent even a week after they're formulated.
So this one is labeled for export only, made in the U.S. I guarantee you we found it within the borders of the United States. New Mexico still is a Minnesota state. Okay. So, and this, we could go on and on. I think we probably have about 20 more pictures, but Kathy will get the hook out soon, I think.
I've actually got one just general question, maybe 30 seconds, minute, if you guys don't mind. Some have just been a little unclear on some of the things with the slides and some of the medications. Is there an appropriate time for some of these meds? And, is it okay to use them in certain instances? There were a few questions on that.
Well, let me take a first shot at that. And because I often come off really anti-compounding because of the material, the stuff that we show, and it is concerning. I think what we all really want is for, whether it's the veterinarian, whether it's the owner, whether it's the trainer, they need to ask more questions. They need to investigate further. If somebody's using a compounded product, they need to know how, when, where, and why. If there's an FDA-approved product, that should be the first choice. If there's no FDA-approved product, then potentially a compounded product may be the best solution. And there is a need and a use for those in veterinary medicine because we don't have pharmaceuticals that could cover everything. But use them, sparingly, only when there is no other pharmaceutical option.
I wouldn't add anything.
All right, thank you.